Alrighty, everybody. I guess we are 5 minutes past 2 o'clock, so we are going to go ahead and get started for today. Thank you, everybody, for joining us today. This is the haunting truth of allied health pathways to the health science programs. I am one of the senior advisors here. My name is Irma Lopez, and I'm going to go ahead and let Frances introduce herself.
My name is Frances Calderon. I'm also an advisor for the Health and Biosciences. Welcome, everyone.
All right, so let's get started. We're going to go ahead and move on to the next screen, Frances. So again, we were just introducing ourselves. You see our pre-COVID pictures. That's the really scary thing. But here we are. So thank you guys again for showing up today. We are both the Health and Biosciences Institute, which is Institute 3. Go ahead and move on to the next screen, please. So these are some of the things that we are going to cover today. We're going to give you an introduction on the programs. We're going to talk to you guys about the most competitive programs. We're going to talk about the mandatory requirements for the programs such as prereqs, college level readiness, volunteer hours. We're going to also talk about conditional acceptance requirements and what that means and what it entails. We're going to talk about the TEAS test and for which programs you have to take the TEAS test for, and a little bit more information about how to study for the TEAS, as well as the USA test. We're going to talk about courses in program of study. We affectionately call that CPOS, but we're going to go into great detail about that because that affects all of you guys. We're going to talk about what makes a competitive applicant, what students need to know when you're applying for any of these health science programs. We're going to talk about proactive approach to a backup pathway. So what happens if you don't get into the program of your choice? And then we're going to do some frequently asked questions that we often get for students like yourself that are trying to get into these programs. We're going to talk about resources that are going to help you to try to get into any of these programs. We're going to share some videos. We do have a peer mentor with us that is going to share his experience about getting into one of the programs, and his name is Eduardo. You might have seen him, he waved, but we're going to introduce him a little bit later. Thank you, Eduardo. And then we're going to talk about all the advisors for all of the programs. And then at the very end of this, we will have a question and answer section. So any questions you've got, I guarantee you, if I don't have the answer, Frances does. So we're going to go ahead and move on.
All right. These are all of our allied health programs. These programs with the star next to them are the most competitive programs. So we have physical therapist assistant, also known as PTA. That is an Associates of Applied Science. Occupational therapy assistant is also an AAS degree. Diagnostic medical sonography, those are our top three. We also have, and that's also an Associates of Applied Science degree. Right underneath, we have the cardiac sonography. That is an advanced technical certificate. So with that one, you need the degree and the credential before you can move on to cardiac sonography. Radiography technology is also in the Associates of Applied Science. Right next to it, we have the MRI and CT. Those are enhanced skills certificates. So once again, you need the degree and the credential to be able to do those certificates. Invasive cardiovascular technology is also in Associates of Applied Science. Respiratory care technology is also in AAS. Vision care technology, that's one of our Associates of Applied Science programs. So is histologic technology or histotech. Surgical tech or technology, sorry. It's in Associates of Applied Science. We have health information technology. Now, health information technology is the only program that you can do fully online with the exception of the 5-week clinical at the end of the program. So if you're looking for something for a program that you can also work and do at the same time, then that would be the program for you. So where was I? Medical laboratory technician is an Associate of Applied Science. Within medical laboratory tech, we have the healthcare tech phlebotomy certificate. And so that one, it's built into medical lab. So that's our level 1 certificate. And let me move on to the next one. So the mandatory requirements. The first thing that you should always do is read the website and also continue to read it every now and then, because it can change. For example, sonography, their deadline changed up until, I want to say a few weeks ago. Their deadline was in June and now it's in March, which is a huge difference, right? Sets back some of the students. So make sure that you are up to date with the information on the website. Every program, and I want to say the majority of them, healthcare tech, they have prereqs, not quite mandatory, but they highly recommend that you complete those. But that's the only exception for that program. All of the rest have prerequisite requirements. So these are courses that you need to take prior to applying. And they do have a point system that they use for selection process. So you have to be college ready. For the ones that are in Associates of Applied Science, you have to be college ready in all areas, math, reading, and writing. There are volunteer hours required for PTA, physical therapist assistant, and OTA, occupational therapy assistant. Now, sonography used to require them, but the past few years they haven't. And so, like I said, things can change. So in the past they did, and now they haven't required them because of COVID, but PTA and OTA for sure do require them. Transcripts are required. Official transcripts from all higher education institutions that you attended, including Alamo colleges, any of the Alamo colleges, those are required for your application. Regardless whether you submitted them to the college, you have to include the official hard copy in your application packet. The majority of these programs require the T's. There are some that don't, but there are some that do. And the ones that do, there's a few, and I'm going to mention them. PTA and OTA, sorry, have a minimum score requirement for the T's exam. So PTA requires a 75 and OTA requires a 65. So that means you have to at least score that in order to be eligible to apply. If you didn't score their minimum, then you need to retest and before the deadline. The USA exam, there is no pass or fail. It's whether you own the skills required for the profession, not just for the program, but for the profession. Information sessions. There are a couple of programs that do require them. They're mandatory. Know which ones they are. If you're pursuing your program and they're offering an information session, one, I highly recommend that you go either way, whether it's mandatory or not. You definitely want to go to their information session. Some of these programs, they'll give you a certificate at the end of the session, or they'll email it to you. Actually, they're emailing it because they're no longer in person. Since they're virtual, they'll email it to you and you make sure that you print it out and put it in your packet. Interviews, there's a lot of programs that are requiring the interviews now as part of their selection process. So there is a method you can utilize. It's called the STAR method. If you need to, if your program requires you to interview with them. Then I believe this one, sorry, conditional acceptance requirement. So once you get that acceptance letter, it's conditional. You're not fully accepted until you pass a background check and you pass the drug test. Now they will send you to the place. They're going to provide that information in your acceptance letter, where you need to go to get the drug screen and the background check. So don't do it ahead of time because they're not going to take it. They will send you. And you do have to be up to date with your immunizations. Now, some of these programs require more because of the type of career it is. So you need to make sure that you are up to date and they're going to give you a deadline. But if your program has a clinical in their first semester, which I know surgical tech does, then that means you need to be up to date by the time you get accepted, because they will need your immunizations. And like I said, they will all give you a deadline. It has to be up to date by your first clinical. So you must have health insurance. Now, you don't have to have it when you apply. Like, none of this is required when you apply. Don't put it in your application. And the reason being is because the clinical sites require it. So you may not have to have it right away, but by that time comes for your clinical, and though, like I said, they give you deadlines, you will need to have health insurance. You have to be CPR certified, and it has to be through American Heart Association. So, and it just requires the BLS, the basic life support for the infant, child, and adult. So if you have it, you can always renew it. It has to be up to date.
Okay, so moving on, we're going to talk about the TEAS test. Many of the programs, not all of them, but a lot of them do require the TEAS test. So we get a lot of questions about the TEAS. So when people ask, what is the TEAS test? We tell you guys it's a standardized test. It's kind of like the SAT. The SAT is a predictor of how well you're going to do in college. The TEAS is a predictor of how well you're going to do in the health science field based on your knowledge of reading, writing, math, and science. So again, the TEAS is just a predictor of what they think, how well that they think that you're going to do. Some programs do, like we mentioned before, OTA and PTA, they do have minimum scores you have to achieve before you're eligible to apply for those programs. That was OTA and PTA. So that's something that you need to know with each of the programs that is applying. The other thing is, of course, there is a difference. There are two different kinds of TEAS tests. There's one for nursing and there's one for allied health. So make sure that you're taking the correct test. Obviously, this presentation today is about the allied health program. So all of you guys, hopefully, that are in here today would be taking the TEAS test for allied health and not nursing. The allied health and the nursing version of the exam are exactly the same. The only difference is how they score them. The nursing gives you a level. Allied health gives you a score. They give you a score of 0 to 100, 0 being the worst, 100 being the best. The higher you go, the better off you are. So that's something else you need to know, right? And then, of course, to be sure to take the TEAS test with enough time for retesting. So for example, I help students in the radiology program. If you're trying to take the TEAS test for the radiology program, because that is a requirement, you need to make sure that you're taking the test in January. So that way, if you don't score where you want to score, you have another opportunity in February to retest before that deadline. Okay, and the same thing with like OTA and PTA, they have a deadline of March 31st. So you need to make sure that you take the test probably in January, probably in February, and then potentially a third time in March if you don't like where you score into. Now, the TEAS test that we're offering, they do offer it here through St. Philip's College. That one, it is proctored, it's completely online at this time. So if you want to take the TEAS test, you would just go to our St. Philip's College website, type in the word TEAS, and it's going to take you directly to the information on how to register for the TEAS test and how to search for St. Philip's College. And then it's going to give you the details on information on how to register for the TEAS test. It is a little bit confusing. And people usually reach out to us, the advisors, for information about the TEAS test, but we're not actually the people that administer the test. So you may want to reach out to the testing office or the 1-800 number that is given to you for the TEAS. Okay. So some TEAS resources, like people are always like, how do I study for this test? So we do offer the TEAS test prep through the TNT Center. Right now it is online, I believe. I'm not sure if they're gonna move to in-person probably in the spring, but I'm pretty sure they were. But the TNT Center is the tutoring and technology. They're on the 3rd floor in the CLR in the library. So you may want to check them out for testing prep. And then of course, SPC Library, they do have a LibGuide to offer you additional information about how to study for the test. And then there's something called the HIT's Pocket Prep app. So that's another resource that can help you study for the test. Of course, Facebook has a Facebook group. So there's a group of people that will join that Facebook group to get information about the T's. There's something called Mometrics test preparation. There's the union test prep. And then in the springtime, we do have an event. It's called For the Love of Teas. I'd highly encourage all of you guys to attend For the Love of Teas event, because it is completely about all of these resources that we just discussed for students, but in person. Last year, I believe we had it virtual, but we usually either have it in person or online. I'm not sure how we're going to do it this spring. But we've got all these people all in usually one room or one Zoom room to talk to you guys specifically about how to study for the TEAS test, how to register for the TEAS test, you know, what other advice they would give you about registering for the TEAS test. So there's a lot of good information out there. Make sure that, you know, if you're really confused about the TEAS test, number one, get with your advisor, of course, because the advisor is going to be the person you need to talk to, you know, that's going to be able to point out these things for you. But definitely when you see that For the Love of Teas event in spring, we highly encourage you to attend so you can speak to the people directly about the TEAS test.
The thing about the T's is that you cannot wait until the last minute to schedule and expect a date to be available. So for instance, like radiography has the first deadline. You can't go in there in February and expect to find a date by March 1st or what have you. Because they open it for anyone to schedule, not just for SPC students, but it's open to everyone. And there's not that many test sites for allied health. There's a few in San Antonio. I had a student who had to drive to San Angelo because back then there was only one and we were the only ones. Now there's more than one, I think, right? There's about 2 or 3 in San Antonio. I forgot to mention that medical lab also has a minimum score. I believe there's a 65. So I just wanted to add that. All right. Sorry, it keeps getting stuck. All right. So the USA program. This is sonography's entrance exam, and they are the only one. And I meant in sonography, I'm referring to the diagnostic medical sonography. They require this exam, and you have to sign up for it on your own. It used to be they would choose who would test. Now it's if you test, if you apply, then you have to schedule yourself for the test. And the time frame we just learned is from December 1st through, I want to say March 1st. And so you have to go in there and schedule if you know that you're going to apply that year. Now, the thing with this exam, you can only take it once. It's pro-life, pro-student. So that means that you can never retest this exam. It's an aptitude exam. It's going to test you on skills required, not just for the program, as I said, but also for the profession. So you have to be proficient with your hand dexterity, with your eye-hand coordination. And these are skills that you developed from child to adulthood. So unfortunately, there's nothing that you can use to prepare you for this. It's either you own these skills or you don't. So it's part of their admission application. And I said, there is no pass or fail. It's only measures whether you have these skills or not. And if you want more information, you can visit the Pegasus website. And I don't think they have a link to it on the sonography website. I could be wrong, but I don't think it's there anymore. But this is it. So you could take a screenshot. That's you, Irma.
Okay, yeah, we're going to move on to courses in program of study, what we call CPOS. So these were the requirements. I noticed it says fall 2020, but they're pretty much the same since fall 2020. That's when this was implemented. But what CPOS means is that financial aid will no longer pay for classes that are outside of your major. So for example, if you're in the radiology program and you're still thinking that maybe you want to do diagnostic medical sonography, and so you're going to throw in a physics class, financial aid is no longer going to pay for that physics class. So it has to be in your program of study for if you're using financial aid for them to pay for it. So bonus classes will no longer be paid. And we gave the example of medical terminology. So that's HITT 1305. A lot of the programs recommend that class, but financial aid will no longer cover it unless an advisor overrides it for you. So if it is a recommended class, and we of course advise you to talk to your advisor and say, oh, is this a recommended class? Is this something that's going to be overridden so that it can be paid for by financial aid? And usually the advisor can do that. Now, if it's something like, you want to take a Spanish class, no, we're not going to override that. If it is a recommended class for the program, then absolutely the advisors can override that for you. But if it's just something because you want to take an extra class, and the answer is no. So if you're a radiology student, you're going to take physics, no, you're going to have to change your major to do something like that so that financial aid can legitimately pay for the course. So what can you do? Of course, you want to create an ISP, which is an individual success plan that incorporates your bonus classes into summer or somewhere in your schedule, so that it will all work out. Like, for example, I don't usually recommend anatomy and physiology with medical terminology because that's just a lot of memorization that you have to do on your end. So I usually recommend that students take medical term during the summer when you can take it alone, and you can focus a lot of your attention on that class, because a lot of those classes, they are difficult to pass. And then of course you can repeat classes. So one of the important things about CPOS, like if you took a class like anatomy and physiology or college algebra and you didn't do well, let's say you earned a C in it, you can retake the class now and earn a better grade. So even though you passed it with a C, you can retake it later on to try to get a B. Or if you got a D, you want to retake it for a B, or you retook it. Let's say you get a B, but you want an A in that class, you can retake it. But of course, we want to encourage you to check with financial aid to make sure we know for sure they will pay for it at least one time for you to repeat the class. So just be sure to check with financial aid about that. And of course, again, like I mentioned, if you decide to change your mind on a major, if you're thinking about two different programs, you can only be a student of one major at a time. So if you decide, I want to do radiology, but now I want to do diagnostic medical sonography, it's really important for you to do that update in your major to make sure that financial aid is covering those classes. And then during the summer, we do offer something that's called a summer momentum program. And it is for students that have completed 18 to 24 completed hours or earned hours in fall and spring. So you usually do earn free hours in the summer, but those free hours do have to be included in your courses and program of study. So, let's say you earn free hours in the summer and then you're like, I'm going to take a welding or a baking class. They're still not going to cover that. So make sure that the courses the free hours that you earn in the summer do go toward your degree, because if they're not part of that CPOS, financial aid is still not going to cover it. And of course, again, check with your advisor to make sure that those courses apply, because if they don't apply, we cannot override them for you. And then just a note that Maymester, a lot of students like to take classes in wintermester or Maymester. Keep in mind that Maymester does not count as summer, and financial aid will not be given. Okay, so if you're thinking about taking a class this December, financial aid is not going to cover that. You're going to have to cover that on your own. And if you're thinking about taking one of those, 3-week classes in May for Maymester, financial aid will not cover it. That's not part of your regular financial aid. So they're not going to cover those, and those are not included in CPOS. All right, so we're going to go ahead and move on. All right, so what makes an applicant competitive? So this is the nitty gritty, right? Well, the reason you guys want to be here. So of course, we want to encourage everybody that is trying to get into the program to exceed the minimum requirements for the program. If the program is requiring a 2.8 GPA, a 2.8 GPA, we want you to do higher than that. We would expect you guys to do a 3.0 or better. Or if they expect a 3.0 GPA, maybe a 3.3 is what's going to help you get into the program. We'd like for you to exceed those minimum requirements. That's what makes your application stand out. And of course, repeating or taking additional classes for GPA improvement. So, you know, if you've got a C or a D in there, we want to encourage you to retake those classes to improve the GPA, because remember, we told you that this is based on a point system. Those points are based on your grades for those prereq and co-req classes. If you retake those classes, earn better grades, it's going to get you additional points into the program that you want, which gives you a better opportunity to get into the program. And then of course, completing bonus classes. So if there's additional bonus classes that you can take to earn more points on your application, we want to encourage you to do that. So if taking medical terminology, and we've listed them here, there's two different versions of medical term. It's HITT 1305 here at SAC. If you take the MDCA 1313, those are both medical terminology. Those will earn you bonus points on your application. So please do that, because every point that you get counts, right? And of course, if they're going to ask you, they want everybody in the allied health field to have be CPR certified. So make sure that you do get CPR certified, because that does also earn you additional points on your application. Volunteer hours. So a lot of the programs will require volunteer hours. Not all of them do, but some of them do. If they're asking for volunteer hours, do additional volunteer hours, because additional volunteer hours can earn you additional points on the applications. So they might say you need 40 hours of volunteer work, maybe do 80. Maybe not that many, but you know what I mean. We just want you to do above and beyond what the basics are to make your application stand out. And of course, if you have any other licensures or certification, include those in your application, because those do count as points. So if you have a degree, for example, if you're working toward an associate of science or an associate of art, if you're really close to getting those, get those additional. If you earn that degree, that can earn you additional points on your application, as well as, you know, getting additional licensures. So some of you are certified in phlebotomy or whatnot, or you're already an LVN, you can include that for additional points on your application. And then of course, there is academic fresh start. So let's say you're somebody that's starting from rock bottom. And a lot of times when you're starting from rock bottom, students get very discouraged because their GPAs, you know, are not very good. There is another avenue for you. It's called Academic Fresh Start. It basically states that if the records department agrees and these courses are more than 10 years old, they can wipe out all those bad credits and you can start all over like a brand new student. So that's another option for students that are trying to start over again. But again, there has to be a 10-year wait period in between. Those credits have to be more than 10 years old for you to apply and be accepted for Academic Fresh Start. And let's move on to the next one. All right, so what students need to know. So of course, these are some of just basic stuff that you guys need to know. Of course, that all of the programs, all of our health science programs have common courses: college algebra, English Comp 1, psychology, ethics, anatomy 1 and 2. Or if you took the combination 2404 class, those are all commonalities in all of the health science programs. Every single one of the programs requires at minimum those classes. And then of course, you need to know the difference between 2404, which is the combination of 1 and 2, versus anatomy 1 and 2. Anatomy 1 and 2, like I said, that one, those are separate semesters. So you'll take anatomy 1 and then you'll take the next sequential class, which is anatomy 2. So you need to know the difference between those. Now, anatomy 1 and 2, those are great options. Those are the ones Francis and I always recommend the students take, because those are 16-week classes. Hopefully you're taking them in 16-week classes. It gives you the most amount of time to digest the information. That way you get a good understanding of that class. Now, biology 2404, the difference is that that particular class was designed for our programs here at Alamo Colleges. So that one is not necessarily transferable. So if later on you decide to change your major, or you decide to move on to a university and not pursue the health science field, that one is not going to probably go with you. So that's why Francis and I usually recommend 2401 and 2402, because if you decide, you don't want anything to do with our health science programs and you want to move on and do something else, or go to a nursing school somewhere else or do something like that, 2401 and 2402 are always going to go with you. But the 2404, that one stays here at Alamo Colleges. So if you are trying to get into a particular program and you don't have that much time, you don't have 2 semesters, you have to get all your prereqs done in 1 semester, then we would absolutely recommend the 2404 for you. If you have a background in anatomy and physiology, we would definitely recommend 2404 for you. But those are only for certain situations, but most of the time, 90% of the time, we're going to recommend that you take the 2401 and 2402. Something else that you should know is, of course, that you need to have a valid individual success plan and your My Mission statement completed in your ACES account. That individual success plan really is important for you guys. So it gives you a good layout of how you should take your courses, in what order you should take them, to make sure that you're maximizing your time. So that you're not wasting additional semesters, that you're able to get all of this done in the best amount of time to apply for your program, because every program has a different deadline. Some of them, like mine, starts in summer, most of them start in fall. We need to make sure that you're done with your prereqs in the amount of time so that you're not having to sit out another semester or a whole other year to apply for the program. So that's why the individual success plan is really critical to helping you guys get the information and get there in the shortest amount of time possible. And of course, we want to make sure that you're ready to commit to these programs. A lot of these programs have, they have a limited amount of students that they can admit to the program. So if you're not ready to commit to a program, then it's probably not a good idea to apply for the program. We do have a lot of students, like for example, they apply for radiology, they get admitted into radiology, they start the radiology program in the summer, and then they go, I think I'm going to try my hand at diagnostic medical sonography. Well, then you've just taken a spot from somebody else, right? Because now somebody's dropped out of radiology that somebody else could have taken that spot, and now they've joined another program. So we don't, be ready to commit to any of these programs, and also understand that any of these programs that you're applying for that we've talked about previously, they are all high stress environments. So be prepared for that, because it's usually not something that students understand that is going to happen to them, that they're going to be stressed out a lot. There's going to be a lot of different exams you have to take. There's clinicals you have to go to. There's comprehensive exams at the end of the semester. So it's a lot. These programs are rigorous, and they are cohorts. So remember that a cohort, all of you guys start together and all of you guys finish together. There's no advancing. You can't go, oh, I think I'm going to add another class next semester so that I can finish sooner. That's not how these programs work. All of these classes and programs are designed to begin and end at the same time. And again, it is a rigorous curriculum. So you are going to be extremely challenged in them. So be ready for that commitment as well. And then of course, interview skills and mock interviews, practice. Practice makes perfect, right? So a lot of these programs, they may require interviews. Interviews do count for quite a bit in the point system. So make sure that you're ready for that. Don't just go in there, and show up in shorts or whatnot. For an interview, be ready to do like a professional interview, dress the part, and speak the part, because that's what they're looking for students that are going to be competitive for these programs. We're going to go ahead and move on. All right. So backup pathways, it's you, Francis.
Yes. So you always want to have something to fall back on. Don't put all your eggs in one basket, because the fact of the matter is not everyone gets in. These are programs that are selective. They have a maximum amount of students that they can accept each year. And some programs receive more applications than others. So you definitely want to have something to fall back on. You can apply to as many programs as you want. You just need to make sure that you know each and every program that you're applying to, you know their deadline, you know what they require, and that you meet all of those requirements. Each program requires a separate application. So that means that you need that many official transcripts. So if you're going to apply to multiple programs, make sure that you have all of your official transcripts for each individual packet, and make sure that you're applying in time by the deadline. And don't worry about whether this program is going to know whether you apply to the other program. Let me tell you, they know. They know students apply to more than one program. Don't worry about it.
Also, can I add that make sure that you are requesting your transcripts in enough time. You remember last year what happened in February, right? We had the snowpocalypse, and a lot of the radiology students were sweating at home, even though it was freezing, because their transcripts did not get there in time. They waited until February. February is a very short month. March 1st came around real fast, and they didn't have their transcripts for that deadline. So make sure that you are requesting your transcripts at least a month ahead of time, at least, because things can happen. Like that was totally out of the ordinary that it snowed, but that caused a lot of stress on students, and the program actually had to extend their deadline because students were not able to get their transcripts in a decent amount of time. But that's not usually the case for some of these programs. These are hard deadlines and they don't usually extend them. So just keep that in mind.
Also, with that being said about the transcripts, that happened to actually this year, they went to a new system. I don't know, they had some type of update for transcripts and students weren't receiving them. They had to request multiple times. So that can happen. Make sure that you're in communication with your advisor. Communicate with them, let them know what's happening. I had a student whose physics class grade didn't get posted. She reached out to me and I reached out to the department. And most likely all those students in that physics class were applying to sonography because they require physics. So I was able to communicate that with the department, and they were flexible with the deadline and the transcripts and so forth. So they understand. You just got to have that communication. You got to be proactive too. You got to advocate for yourself as well. So another step that you can do is consider programs at the university. So say, for instance, you were pursuing our respiratory program. They do offer it at UT Health. They also have medical lab at UT Health. And so that's a backup plan. Say, for instance, you didn't get into sonography here. We would hate for you to go to another institution, but if that's your goal, if that's your academic goal, then we want the best for you. Consider other sonography programs or any other program outside of Alamo colleges, and you can always reapply the following year. However, you need to make sure that you're working on your either your GPA within that year, you're retaking courses if you needed to. You have to improve your application for the next year, right? And you can have that discussion with your advisor. What can I do to increase my chances for next year if you want to reapply? You got to have that communication, because remember, CPOS, especially if you're using financial aid, you got to let them know what you plan on doing. You're going to need to reassess. You're going to need to edit your GPS plan. So just make sure that you're in communication with your advisor once you get that notice. Whether you get in or you don't get in, we need to know, because there are some steps that we need to do on your records as well. So there you can do career exploration. Make sure that you attend other information sessions. I had a student who was like, well, I'm not, that's not my major, but it doesn't matter. It's okay. You can still go. They don't know which programs you're applying to. They're just there to inform students and about their program. So you don't have to be pursuing that program just to attend. If you want to know more about it and you know nothing about it, you can attend, join them. I send out the flyer for all of the information sessions, and you can go to as many as you like. You can also do some shadowing, especially if you have no background in healthcare. If you're able to, now I'm telling my students, if you want to go, one, it's hard to do it right now because of COVID. But if you're willing to do it and you know someone who can get you in to do some shadowing or volunteering, then we highly recommend that you do, because we offer so many health programs, health science programs that you may not know of. So if you're open to other careers, when you do have to be open to other careers, if you want to explore others, and that way you have something to fall back on. And we have great programs. It's just knowing what you want to do and knowing what you're going to be happy with, to be honest, because I've seen it all. I've been advising for these programs for 8 years, and I was once the only advisor for all of these programs. And so I've seen it where students, they pursue one program because they just thought this was it. This is what they wanted. And I've seen students drop out their last semester, up until their last semester, because it wasn't for them. So I would hate for that to happen to you. So if you're not able to volunteer, watch some videos. There's YouTube videos now of each profession. I've seen them. So you can do that if you're not able to volunteer. Do a career assessment. Right now we have Commit to Complete all this week. There's so many events going on. One of them is specifically for this career assessment. It's on the SPC calendar. So if you're interested, you can do Focus 2. That's an assessment that you can do. There's also Career Coach. That's another assessment that you can do. So if you're not quite sure what your backup plan is, take that assessment and discuss it with your advisor. Let them know what the results were. And it may not even be one of the health science programs. I've had students who changed their major to business management, teaching. It could be something completely different. It's just a matter of what are you open to? What do you want? Because in the end, this is your career choice. This is going to be your career.
And not to mention a lot of the programs, since all the programs have very basic classes, like the commonality ones that we were talking about earlier, a lot of them, like if you don't get into radiology, you can join respiratory care. They have the same prereqs. That's why it's important to talk to your advisor and say, okay, I didn't get in. Now what? Now what can I do?
Mm-hmm.
It's like, oh, okay, well, there's 2 other programs you can apply for if you didn't get into this one based on what you've already done. So, we know it may not be your first choice, but it's definitely worth exploring other options.
And also because we want you to make a well-informed decision. I've seen students who didn't get into their program of choice in the last minute. They just chose a program because they were still accepting applications, and they did it. And sometimes they end up not being happy. They come back, I thought I would like this, but I don't. And so they just did it. I want you to make a well-informed decision, not just because they were still accepting applications,
Right.
All righty. So,
all right, so we are going to discuss some frequently asked questions that we get from students all the time. So I'm going to ask questions. I don't expect any of you to know these answers. So Francis is going to answer them for you. All right, so can prereqs and co-req courses be completed at any institution?
Yes, they can. They can be completed at any of our sister campuses. If SAC is closer to you, or if Palo Alto College is closer to you, then you take it at Palo Alto. You take it at Northwest Vista. We want you to make your academic career or your pathway more convenient. Don't try to just come over here because the program is here, but your prereqs can be taken over there. Just know that once the program starts, it's going to be here. So also I've had students who have taken it, maybe the deadline was approaching, they've taken it at an online college. Just make sure that it is regionally accredited. It has to be regionally accredited, because if it's not, then your credit won't be posted. We won't accept those classes. All right.
Okay, so here's another good question that we get asked all the time. Do advisors or the Allied Health Department assist with the application process?
No, I do not. As nice as I am, I will not help you put your application together. And the reason being, it's a liability. So we do not help you, nor will the Allied Health Department or Health Science Department help you put your application together. And one of the skills that they're looking for is learning how to follow directions, you know? So definitely we can answer questions.
Yeah, we will answer all the questions you have, but unfortunately we cannot help you fill it out.
No.
That's too much of a liability on us. All right, so let's move on to the next question. Are interviews conducted during the admission process?
So yes, I know sonography does it, and so does respiratory. And surgical tech was doing them. I don't know if they'll do it for next year, but several of these programs are starting to incorporate it as their part of their selection process. Because, you know, one thing, you have to know what you're getting into, you know, you can't just pursue a program just because you know that that the career is great, they pay good, and what else do you know about the career? You know, you have to be well informed. So hence why they started interviewing students.
Okay, well, that brings us to our next question. Do these programs deal with blood and internal body organs?
Yes.
And
So
smells.
smells, blood, sonography used to mention it a lot, that because it's invasive doesn't mean that you're not going to be exposed to smells, blood. You will be. So just keep that in mind, especially with med lab. You're going to deal with all kinds of smells.
So just know that ahead of time. And also know that, you know, some of the programs, like, especially with COVID now, like anybody in the respiratory category, you may have to deal with, you know, people dying. So know that as well, going into these kind of programs. Because we'd hate for you to get involved in that and then figure out that this is causing PTSD or something like that. Okay, so next question. When do these programs occur? Weekend, evening, are they part-time or full-time?
So the majority of these programs are during the week. Now, some are, it just depends when you do your clinicals and where your clinical site is, because you have to go during their hours of operation. So if this clinic is open only on the weekends, or they have weekend hours, then that's when you'll be going, is during the week. I mean, in the weekend. And if they're open at night, you might have to go in the evening as well. It's just, like I said, it just depends where they send you. All clinical sites are different.
And you didn't talk about part-time or full-time.
Oh yeah, so most likely you cannot go part-time. The only program that allows you to go part-time, and this is the only program, Health Information Technology is the only program, and that program is online, like I said, with the exception of the 5-week clinical, your last semester. So if you still need to work your 9 to 5 or 8 to 5 job and still go to school, then that would probably be your best option if you want to work in the healthcare field. So some semesters are full-time, some are not, but I can guarantee you once you enter the program, when it's not full-time, you're going to feel like you're going full-time because they are rigorous programs. So it requires a lot of study time.
Okay, moving on. Are there any additional fees associated with the allied health programs?
So once you enter the program, there are special tuition fees. I believe, don't quote me on this, I believe it's $700 for each full term on top of your regular tuition and fees based on residency, right? Whether you're in district or out of district. And then in the summer, it's less. I am not quite sure what the amount is. because it's a shorter term, I believe it's less. And your books are expensive. Did somebody?
Yes, it was me. It's Eddie. Yes, so it was $350 for the summer semester for sonography. So I assume it's the same for all allied.
Yes, it is. Okay, so 350, so half the price, because it is a shorter term. So your books are more expensive. You're gonna need scrubs. You might need other items, so, or materials. So just know that once you're in the program, it's going to be a little more expensive, but we have some resources for you.
We're going to talk about those later. Do you recommend shadowing or volunteering to students with no previous healthcare experience?
I definitely do. And the reason being is because if you've never worked in the healthcare field, then
all right.
I highly recommend it. Yeah, because
do you see the comment? They put
no, I didn't. Sorry,
75% off at the bookstore.
Oh, there you go.
There's a sale going on right now. Thank you.
Yes, and also when they interview you, they'll ask you, "Have you ever had healthcare experience?" And sometimes it does help you to have that. Like Irma said, the more hours you do, you may get more points. Now, it just depends on the program. And even if they don't give you points, I feel like it'll help you out. I've had students who've done it because it was a requirement for one of the programs. And when they did it, they realized that that program wasn't for them. That because they saw it in action. And they're like, you know what, I can't do that. I want to do this. So they chose a totally different career. So definitely.
All right, well, let's move on. So Francis is now going to talk to us about spooky resources.
So the resources that we have on campus, tutoring. So we have Math World right here on campus. There's also a math tutoring lab at the Southwest campus. The Bird Sanctuary is where you'd want to go for all your sciences, for biology, physics, chemistry. You definitely want to go to the Bird Sanctuary. We have the Writing Center. So if any of your classes require you to write an essay or a paper, you definitely want to join the Writing Center. It's also available online through Canvas. If you weren't aware, we do have online tutoring through Canvas. Tutoring and Technology, they offer seminars on success. They have pre-recorded videos on their website, so you might want to take a look at those. The TEAS Prep, that's the department that also offers the TEAS Prep. If you can get assistance at any of the other tutoring labs, or there is no tutoring lab for your course, then TNT is where you want to go. If you need help with psychology, you can go there. If you need help with just about any other class, you can go there. Medical terminology is going to be your instructor, or you can use CLR, because CLR has LibGuides for TEAS. They have LibGuides for all of your biology courses. They have LibGuides for chemistry. They even have LibGuides for medical terminology. And so that's a great resource to utilize. I don't know if students were aware of that, but they have great resources, especially for anatomy and physiology. So we have the Student Advocacy Center. Within Student Advocacy, we have Safe Space. In Safe Space, you can go to get some lunch, grab and go. They have counseling, they have financial literacy. Now they have the closet where you can, they have the pop-up closet. We have it during Commit to Complete. So if you need an outfit for your interview, you can go grab an outfit. We offer scholarships. Once again, Commit to Complete. There's a video about scholarships. So if you don't know how to go about it, they have a video available right now that you don't even have to leave your room. You can join online. Most of these events going on are virtual. There's financial aid. You can use Pell Grant. There's loans. There's the Perkins voucher, which helps you pay for your books and for gas, because you're going to be commuting to these clinical sites, you can utilize Perkins voucher. You do have to receive financial aid in order to use the Perkins voucher. So there are community-based resources. There's Project Quest, and then there's training for job success. So these community resources, they help pay for tuition, they help pay for books, they help pay for scrubs. In some cases, they help pay for utilities, you know? So these are great resources. I do believe you have to live in Bexar County, though. I'm not quite sure. They do offer information sessions, so you can go to their website and check it out.
Also, next to the safe space, we do have the RN Monday through Friday for questions, concerns, and the possibility to shadow. So Nurse Russell, you wanna talk a little bit about that? You're on mute.
I can. Good morning. My name is Russell Adamski. I am the RN for St. Philip's College. I am out of the Health Clinic in the Sutton Learning Center, room 127. No appointment necessary. It's just walk in. We're available for blood pressures, ECU-checks, over-the-counter medications, Q&As, even if it's just a mental health break if you want to come by. And I never mind answering questions. I started out in the pediatric ICU and neonatal ICU. I've always done critical care, mainly pediatrics, and now I'm doing adults, I guess, technically.
Awesome.
But I'm always available. And you were talking about volunteer hours. Anytime that we have a blood drive, we just had our first one again back on campus today. We will give you, the Department of Student Life will give you 1 hour of volunteer community service time if you donate blood in our blood bus. So to help your transcripts. That's it.
All right,
Thank you.
thank you.
You're welcome. Thank you.
So that's one thing I didn't mention, is that your volunteer hours, you can add to your non-academic transcript, which is your experiential credit, right? Once again, Commit to Complete is offering a seminar on this. So if you want to add it to your non-academic transcript, which one you can utilize not only when you're applying to these programs, but for employment, if you're trying to gain employment, you can add all of that to your non-academic transcript. I've had students add all of their volunteer hours on there. If they were part of
this one.
Yeah, definitely. You can get credit for this as well. And so all of that is going to be posted on your non-academic transcript, and it's something official that you can submit with your application, not just to the program, but when you're applying to your jobs as well. All righty. So we do have some videos. I'm going to have to stop sharing to bring them up. The first one, I'm going to share, is our cardiac sonography program.
Did you share the sound?
Incredible Pizza has more
Wait, do you hear it?
attractions
Yeah,
and
it's
fun than any other place
Okay.
in town. We also have one of the largest.
Welcome back and happy Tuesday. You know, finding out what you want to do in life can be kind of challenging, but thankfully this morning, Roma actually found out about a program over at St. Philip's College that could set you apart from the rest. Take a look.
Sorry, I tried to put it louder.
Good morning, everyone. Did you know that heart disease is one of the leading killers in San Antonio, meaning it's one of the #1 causes of death here? So that's very shocking to hear, but today I'm at St. Philip's College with Ben Ochoa. He is with the Invasive Cardiovascular Technology Program, which is obviously really important in this heart disease situation.
Yes, ma'am. We operate in the cardiac catheterization lab, and we teach our students to be soldiers on the front line of heart disease. So they go through our 2-year program here, nationally accredited here in South Texas, and their outcomes, they are expected to operate in life or death situations coming graduation.
And how important is this, like with us saying that it's one of the leading killers in San Antonio and even in the nation? what kinds of things that people might not know about heart disease, this program can help them fight against it?
Absolutely. We learn a lot about, in our program, how the heart operates and some of the factors that affect the heart. We see a lot of that here in South Texas. We see a lot of heart disease, and we teach our students different aspects of the heart disease.
Ben, you use a lot of technology to make sure that these students get hands-on experience. What are we looking at here?
So right here is our patient simulator, and instead of operating a normal cath lab where you get a lot of radiation, right here we can do a simulated E kind of classroom learning right here without the radiation dosage. And what we do is we teach our students to utilize the tools that are essential to treating this heart disease, to going in and maybe through the arteries and the veins, and to either operate diagnostic means or intervene if there's a problem.
Wow, that's so important, because literally, like you said, they're in the front line between life and death. And one of your students here is also even working at a hospital, right?
They're noticing firsthand how the pressure that kind of happens, and a lot of duress that happens in treating these patients. Very often, these folks are under extreme duress. A lot of these guys are almost out the door.
Oh my goodness.
Yeah, so these students have to kind of rise to the occasion, and they're under pressure, they're under clock time to treat these folks, and they do, and they overcome that, and they save lives.
Wow, I mean, that must be so rewarding to know that you can potentially make sure someone will still live. But aside from that, in your own life, if you join this program, you will make a good living as well.
We work hard, and we definitely are well compensated for it. So most of the students that graduate here, they go from one class to the middle class very easily. And there's no shortage of heart disease or clients, so they always have job security.
That's very true. How can someone get involved? What do they need to do to get enrolled in this program?
So to get enrolled in this program, you can check out our website. All the requirements are on the website. You can scroll through. It's a 2-year degree. There are some prerequisites, which you can find on the website as well. If you are interested, or anybody that's interested, there's instructions to apply.
Perfect. Well, this was very informative, and I hope you learned a little bit at home as well. Thank you very much for your time, Ben.
Thank you.
Okay, so that was actually invasive cardiovascular technology. I apologize, it's a cardiac sonography. Let me bring the next video. This one's respiratory care technology.
Looking for a job in healthcare? Start a rewarding career as a respiratory therapist. Become a vital healthcare team member. You could earn between $42,000 to $60,000 as a respiratory therapist. What is a respiratory therapist? A respiratory therapist is a certified medical professional who specializes in providing healthcare for your lungs. What do respiratory therapists do? Assess patients, analyze chest x-rays, analyze blood oxygen levels, administer breathing treatments, manage artificial airways, manage mechanical ventilators, and so much more. Apply for the Respiratory Care Technology program today. To learn more,
Sorry, those information sessions are outdated, so that's why I stopped it. But let me stop sharing. I got more videos. This is our vision care technology program.
Hey everyone, if you're interested in looking towards a brighter future, then you might want to check out the Vision Care Technology program here at St. Philip's College. And I am joined by instructor Sonia Gentry. Nice to meet you.
Nice to meet you, Roma.
So tell us about this hands-on experience these students receive.
So the students are going to learn different types of equipment, and this is going to get them ready to go into clinicals as they prepare to work with ophthalmologists and optometrists.
So Sonia, why is this program so unique?
The students are going to leave here with a great education. It's going to be an associate's degree and the experience that they need for employment.
That is so wonderful. And you guys just had your first ever graduating class, correct?
Yes, we did. We had 8 students graduate from the program and 6 are already employed.
Oh my Gosh, what does that mean to you?
We're very excited. We're so pleased that this is moving along, and we're so happy for their success.
This is a true sign that it works, guys. So all we need you to do is click the link right now and check out St. Philip's College.
Okay, so they just recently got their accreditation as well. So that's great. I got one more video.
There's a question, Francis.
Oh, okay.
Go ahead, ask your question. You're on mute again.
Who?
Nurse Russell?
Oh,
I was just applauding.
Oh, okay.
I was like, I thought that was a question,
No,
but thank you.
more applause. More
Okay, gotcha.
Okay, so let's play this one. This is our medical laboratory tech program.
We can sum up McDonald's
about
crispy
the
chicken
ads.
sandwich in one word: crispy. But also juicy and tender. Maybe crispy, juicy, tender, all one word? Okay, fine. You'll just have to try our crispy chicken sandwich to understand it.
Get medium fries free with the purchase of any crispy chicken sandwich, like a spicy crispy chicken sandwich, only at McDonald's. At participating McDonald's.
Ba-da-ba-ba-ba.
If you're looking for a career in the medical field, we found a school that's perfect for you. Christina went to check it out.
Hey everybody, we're here at St. Philip's College because they have the ability to open the doors to some amazing career opportunities. Here to tell us all about it is Ms. Thurma-Jean Jones. Thanks for having us.
Thank you for inviting us.
So I hear all the buzz is on one particular program,
Yes,
the
it
Medical
is.
Lab Technician. So what's this buzz all about?
Because medical lab technician is constantly growing as our healthcare fields grow in the United States, and we give you an opportunity to learn all about clinical medical labs right here at St. Philip's College.
What does that mean?
That means that when we're trying to find that diagnosis, we're trying to find out what's wrong with that patient, we need to look at their urine analysis, we need to check their blood work, we need to see what type of infection is growing, and those are the skills that you learn in a medical laboratory.
Now, do you need some particular skills to be able to take on a program like this?
You do not. We will start you out from the cradle, just like a baby. So what we're gonna do first is get your basic courses, like your math and your English courses and human anatomy courses out of the way, and then put you right into this program. It's a 2-year program, and in depth you're gonna learn hematology, parasitology, all those parasites running out there. You're going to learn about the chemistries of the blood, and that's what we do here at Clinical Lab. We have an opportunity for you to start off and learn all the particulars about a medical lab technician and what they do in the hospital. They just don't draw blood, they analyze the blood as well. And I always say it's like that beginning of a forensic study, you know, being that CSI person. We had a great fun activity one time here from one of our other instructors. They looked at DNA and they did like, hey, can we find who the criminal was right here in our lab? Wow. And that was awesome. I mean, particularly awesome, just to open your eyes up and see what you can do with the beginning of medical lab and if you continue your studies.
And you're an instructor, so it sounds like you also have a lot of fun.
Oh, I absolutely have a lot of fun. It's very passionate to have your students come in not even knowing how to use a microscope or not even knowing, oh, is this a cover to put on a slide? Oh, that's blood, I'm scared. It's just a drop of blood. And then you see that determination in them and that confidence they build after a while, right? And then you know that they're gonna be a great lab tech.
And it sounds like it's a really rewarding job as well.
Right, because you know, when you have an opportunity to help someone figure out the mystery of why they're ill, and you're going to provide the background information for the doctor to treat them, you know, that's really rewarding to know that I did a part in helping you become more healthy.
Absolutely. And so to be able to complete a program like this, how long would it take?
2 years. This is a 2-year program. In addition, of course, your basic course, programs, your basic studies have to go on, but we can do that as you are in this program, and that's one great thing.
So for anybody who wants to learn more about this program, or if they're ready to sign up, what do we need to do?
All they have to do is call 210-486-2050, and we will schedule them a tour and an interview right here at St. Philip's College.
Thank you very much.
Thank you.
So in the past, we used to give you a tour of the labs. We can't do that no more. So this was the closest thing that we can offer. So let's get back to the presentation. And let me share my screen. Oh, oops, sorry, wrong. So the next slide is Eduardo, our peer mentor. Eduardo, please introduce yourself.
Hello guys, my name is Eduardo Herrera. You can call me Eddie. I am a second-year sonography student. This is my 4th semester, so God willing, May will be my last and I will start working after that. But I wanted to open this up if you guys had any questions specifically about the sonography program or just allied health in general that I might be able to answer. Does anybody have any questions?
Actually, before we get to the questions, Eduardo, can you share your experience pursuing this program and also during the program?
Yeah, so she's not kidding when she says it's a rigorous program. You are going to be studying a lot and you're going to have to be really good at time management because a lot of us do work, go to school full time, and then we have clinicals on top of that. So the way clinicals work is you have your regular classes that you do in person or online, and then 3 or 4 days out of the week, you're also going to a hospital and working there for an 8-hour shift, sometimes longer, sometimes weekends, like she said, sometimes nights. So you're going to have to have a good plan, and especially if you have kids or family things going on, just have a plan because you're going to be busy all the time. So very rigorous program. I was originally going for technical theater, but decided I wanted something that was going to challenge me more, where I could help people, that I was going to have better job security. So I decided on the sonography program. I did my prerequisites in San Antonio College, and then I came here to St. Philip's, where I was usually bugging Frances and asking her different questions, but she helped me. She was awesome. And in regards to being in the program now, like I said, I'm taking 4 classes. I'm also doing 24 hours of clinicals, and then I also work on top of that. So it's a very busy schedule. Just be ready to put in that work, and it'll definitely pay off in the long run. But Frances, did you have, or Irma, did you have something else?
Yes.
Can
you talk about like how it was submitting your application? Was that like super difficult for you taking when you got into the program? Did you take the TEAS or the USA test or?
They did not have the USA test yet. So I'm assuming that I don't even know what it is, to be honest, but I'm assuming that it has to do because with sonography, you're looking at an organ in 2D and you kind of have to imagine it as a 3D organ in your head. So you'll know how to move the transducer over the body and what you're looking at. So I'm assuming that test has something to do with that, just to see how your hand-eye coordination is. So definitely look into that. As far as the application process itself, the majority of it was on the website. Pretty much everything was on the website. I did go to one of the information sessions that they had in person back in the day. Right now they're on Zoom, but either way, they're going to provide you with all the information as far as what the application entails. Taking your TEAS test, volunteering, making sure that you have your transcripts ready to go and you submit everything in a packet to them. And back then the deadline was June the 1st. So I submitted everything, I want to say sometime in May. By about July 1st, they were contacted me saying that I had made it to the 2nd part of the process, and then they wanted to interview me. So that interview, it was during COVID, so it was all on Zoom, but we did have to get interviewed, and then they finally selected the process. The director said that the program was they got about 86 applications. They only chose 18 for my class. Out of those 18, we are now down to 13. Some people decided the program wasn't for them, and some people unfortunately just didn't make it through, but right now we're at 13. So it is a rigorous program. But the application process itself, yes, there's a lot of steps to it. It's not impossible and it's not that complicated, as long as you give yourself enough time.
And how many times did you have to take the TEAS test, just out of curiosity?
Just once. I am an
Oh, you're one of the
overachiever.
lucky ones.
However, I did do a lot of tutoring, which back then was in the library here at St. Philip's College. Now I hear it's in the tutoring center, the new building.
And that was my
So-
follow-up question. How much studying did you have to do for the TEAS?
Well, I was pretty good with the English and the writing portion. It was more of the math and science. So they'll have different times where you can go for tutoring. So just take advantage of that, even if you just go once or twice a week, but still go. They do help you out and it's free. So why not?
So like I always tell students to study for the TEAS and nobody listens to me, but you did apparently listen to Francis. So did you do,
Yes.
you did have to take a good amount of time to study for the TEAS?
I did, yes. I started trying to do it about a year in advance, just because I knew that this was the program I wanted to get into. It is a difficult test, and you do have to, you definitely have to study. You definitely have to register in advance, because there are limited times and places where you can take the test. But like I said, take advantage of that tutoring, because it definitely was a lifesaver for me.
Also, some of the classes that you take, the prerequisites are going to prepare you for the exam. However, the science portion always gets the students, because it's going to test you not only on human anatomy physiology, but it's going to test you on chemistry, has a little bit of physics, may have some micro or nutrition. It's all of the sciences within the health and biosciences. So just take note of that you're going to be tested on all those subjects. And if you don't know it, then definitely take advantage of all of the resources available to help you prep for it. So give
Stand
yourself
out from all the
sorry.
rest by becoming a CFA charter
Hold on.
holder.
That's funny.
Sorry, I thought I closed down every window. Oops. No, so give yourself a good semester to prep, right? Don't just take it. And one, it's expensive. So don't just go take it just to take it and see where you're at. I mean, it's over $100. Make sure you put a lot of prep time into it.
Did anybody else have any questions for Eduardo?
I do have one question, yes.
Okay, great.
How difficult was it to find a job while you were doing the program schedule as well? Because I know that the program is pretty much like a full-time job itself. Would you recommend a part-time job? I mean, a full-time, how difficult was it just to find a job once you got in?
So I was actually working at a call center full-time when I got into the program. I had to cut that down to 25 hours a week maximum. And I've been trying to keep it at about 25. It's almost impossible. I think 15 is doable. Anything more than 15 hours, you are going to be cutting back on your sleep. You're going to be not seeing your family as much as, I mean, you're not going to see them as much as you wanted to begin with, but even less. So I would say no more than 15. Right now, I am working here in the advising center as a peer mentor. So it's kind of like work study, and I work 15 hours max, because then you're also doing 24 hours of clinical during the semester on top of your classes.
Thank you.
You're welcome.
So there's a question in the chat that says, to volunteer, what resources were helpful to find those opportunities? Did you ever do volunteer hours, Eddie?
I didn't have to do them for the program, but I have done them in the past, like with nursing homes. And what you can do is just call different nursing homes and ask them if they take volunteers. The majority of the times, yes, they are very happy to take volunteers, and they'll have you doing things from just helping the patients with just daily things, maybe keeping them company, reading to them. just different things like that. What I would recommend though is if you are interested in a particular program, call a hospital and try to see if maybe that department will let you volunteer, because it's different volunteering at a nursing home than it is doing sonography or doing nursing or something like that. So I definitely recommend trying to volunteer at a hospital doing the program that you're interested in.
Yeah, definitely the ideal place. First of all, the ideal place is a hospital. However, it's very difficult to get into a hospital. Some of these hospitals have websites specifically for volunteering. And so you can go onto their website and find their volunteering page. And some of them have applications that you can submit. Like he said, it's very easy to get into nursing homes, hospice, right? They're always looking for volunteers. So you can do it there. I mean, there's different professions within the nursing homes and hospice as well.
Hello, I do have a question for Eddie.
Yes, what's going on, Nancy?
Hi, I was going to ask you for the clinical part, since I live close to New Braunfels on the Cibolo, is there clinicals like all over San Antonio, or is it mainly, because I heard them say about Floresville or somewhere in the south? Is there anything towards northern?
So most of them are in San Antonio, but specifically for the sonography program, that we do have 5: Floresville, Kerrville, Jordanton, Seguin, and I want to say Hondo is the 5th one. But what they try to do is they try to rotate us all so that we at least go out of town one of the sites. What you could do once you get in the program is possibly talk to your director to see if you do live out of town, maybe they'll let you do some of your clinicals at one particular hospital that's closest to you. Keep in mind that's going to depend on a lot of different factors, such as the studies that they do and how busy they are. They don't want to keep you at a really slow hospital for the full 2 years or the full year, however long the clinicals are, because then you won't get that experience. So they are going to want to move you around, so just be prepared to drive. I was at Jordanton for 8 weeks, and it was an hour drive for me to get there and an hour drive back. So not ideal, but at least I did get different experience there. And that was only for 8 weeks. And now I'm in San Antonio. So my drive now is about 19 minutes, a lot better.
And I think it also depends on the clinical coordinator. So they're not always going to be the same. What he's doing now may be different in a year from now. Eddie, I was going to ask you, as far as your volunteer hours, did you do the minimum amount, or did you exceed the minimum?
I exceeded the minimum, and they do give you extra points the more hours that you do. So definitely take advantage. It helps you to get that experience. If you're doing something like nursing or sonography and you can get volunteer experience doing that, awesome. But if not, at the very least, you are interacting with patients, which is very important for the job that you're wanting to do.
Anybody else have any questions? All right. Oh, somebody asked a question. It says, do you remember how the interview process went as far as the type of questions they asked?
It was almost like a job interview, to be honest. They did focus more on how I was, or how I had reacted, or experiences with volunteering, with being in a hospital setting, how I felt about blood, how I felt about different smells. And then especially in the sonography program, one thing that they also made sure I understood is that it is not just looking at the abdomen or babies. Sometimes you have to do exams that are more personal. So they do require you to do something like an intravaginal exam or a scrotal exam, things like this that you normally don't think of when you think of sonography. But they did want to make sure that I understood that these are expected of me. So the questions are essentially kind of like a job interview, but they're more medical focused, just to make sure that you're ready and know what you're signing up for.
Thank you. Anybody else have any questions?
I've had some students that were interviewed, and I asked them, what type of questions did they ask, so that I can share that information. Some of the questions that were asked were, what are your study habits? Do you know how to manage your time? Because here's the thing, they want to know, they want students who are fully committed, not only just mentally, but financially, right? because you may not have your full-time job anymore once you enter these programs. And so one, you're going to need to find a job that's flexible, right? Because you may not be working in the morning. You'll probably have to work at night. You might have to work in the weekend. So you need to find a job that's going to be flexible. And so the questions that you'll be asked are to find out whether you're going, one, if you know what you're getting into, right? But also are you going to be able to commit to this program? Because they need students who are going to complete, right? Who are ready for this profession, who know that what they want and are sure of it. So those are the type of questions that they're going to ask you to get that information.
Anybody else? Comments, questions?
There's another question. So how much homework do you get, Eduardo, and what are the labs like?
So homework wise, so right now I'm taking 4 classes. One of them is considered a clinical class. So for that one, my homework is usually coming home after being at clinicals all day long and putting in the information for my patients. So like their symptoms, their age, and then what I would diagnose them with based on what we've learned in class. So that's just for that one class, that's clinical class. The other 3, for one of them, I actually have lab on campus that I go to once a week. That one I have competencies, so tests that they have me do where they actually observe the way I'm doing things. Homework for that one is also your normal tests where we have, workbook stuff that we have to do once a week. We also have to do a discussion where we're discussing what we read for that chapter. And then we have to respond to each other on top of that too. That's also for a grade. My other 2 classes will also have workbook things. One of them has weekly quizzes, but the quizzes are only about 10 questions. And you have to go on Respondus lockdown for that, where, blocks down your computer so you can't cheat. What else? Those are essentially it is a good amount of homework. I want to say about 9 assignments every single week and 1 or 2 quizzes every single week. And that's not including, like I said, the 24 hours that I do on Monday, Wednesday, Friday. I'm in clinicals from 8 to 4. And then in 2 weeks, we're going to switch and I'll be doing Monday, Wednesday, Friday from 4 to 10 at night. And then Saturdays from 12 to 6 as well. So that's going to be interesting. I haven't done a weekend one yet. But back to your question, that's what my homework's like.
Anybody else have any questions?
They asked what are the labs like? Did you answer that?
Yes, you did.
You did? Okay.
Yeah.
So does it become hard to balance social work and school life?
It is, yes. So I've had to make appointments and like block off time to spend time with family, spend time with friends. And it's been getting shorter and shorter every semester. So one of my friends was trying to schedule something or trying to say, can we hang out? And I was like, well, I'm looking at my calendar. I have you for 2 weeks from today at this time. And they're like, we have to make an appointment with you. And it's funny, but it's true, because you have so much things going on that you do have to be really good with your time management and block off time for homework, time for work, time for sleep. You're going to be really good at time management by the time you're done with this program. We have another question.
Yeah, there was another question. It says, from what you know now, after all the challenges you went through, is it still worth being in the profession?
Definitely. It is a lot of work, but it's very rewarding. Like I said, I was doing technical theater before this, but I wanted something that was challenging. This was definitely challenging. I wanted something where I was going to help people. I'm helping them every single time I'm in clinicals. Just helping them get diagnosed, it makes a huge difference. Even just talking to them and just making them feel better about their day, it makes a difference, and they will thank you for it. So yes, it's a lot of work, but it's definitely rewarding. And speaking to the sonographers, because I work with them during clinicals, it's very rewarding, and you also get compensated very well. So that's also a definite plus. I think we have another question. Oh, Russell agrees.
Anybody else have anything else they want to add? If not, we're going to move on. we'd like, Francis and I would like to introduce you, not introduce you, but we're going to give you the names of the other evil advisors that work here. I'm just saying that because this is a Halloween theme. All right, so here are your evil advisors here at St. Philip's College. I have myself at the top of that list, Irma Lopez, and I do help students with radiology program. Francis does diagnostic medical sonography, evasive cardiovascular, surgical tech, and cardiac sonography. And then we have Juan Venegas, and he does health information technology, respiratory care technology, phlebotomy, and medical lab technician. And then we have Douglas Gable. He does occupational therapy assistant and physical therapy assistant. And then we have Teresa Hopwood, and she does vision care and histologic technology. So if you'd like to take a quick picture of this, if you like our email addresses, that's where they're at for you to do. And then we'll go to the next page. And we have more evil advisors that work here. We have Shannon Johns. She does diagnostic medical sonography, occupational therapy assistant, and physical therapy assistant. And our newest advisor is Luis Sanchez. And as of right now, he's scheduled to do radiology technologist, but that may change. So we are adding additional advisors, but we don't know who they are yet. So when we do, make sure to reach out to any of us to find out who the newest advisors are, because we do specialize in these programs. These are our specialties. Okay. And then we're going to go ahead and move on. Question and answers. If any of you guys have any, I know we answered a lot of them already, but if anybody else has anything additional, we are happy to help answer any of those questions for you.
I had a question about the career assessment that you mentioned earlier, Francis. Can you talk more about that?
So what it's going to ask you is the focus 2, I believe, I don't quite remember how many questions there are. I know it has more questions than Career Coach. Career Coach only has 60. So it's going to ask you questions about yourself. And when you do these assessments, you don't want to think long and hard about the answer, just answer it what comes to mind. And so once you're done answering all these questions, it's going to give you a list of careers that best fits you based on how you answered those questions. And so I know they're talking about it during that commit to complete, but we also have links to it on our website under career services. So if you just type in career services on the search on the SPC website, you'll find that on that webpage. There's a link to Focus 2 and then also Career Coach.
Thank you.
You're welcome.
Anybody else have anything?
Ms. Calderon, I have a question for you.
Sure.
I have a VIA advisor. Would I still be able to message you questions regarding sonography? Because I don't think he would be very good at answering my questions regarding sonography.
Sure, you can. I have drop-in advising, and this is only for those who aren't assigned to me. The ones who are assigned, you schedule an appointment with me, but you can drop in on Thursdays from 9 to 1 and drop in. You have to come in onto the campus in the Welcome Center, first floor. From 9 to 1, I'll be able to assist you with any questions that you have.
Okay, then I will see you Thursday because I do have a few questions.
Okay.
Thank you.
You're welcome.
Francis and I are drop-in advisors on Thursdays from 9 to 1. So if any of you guys need to talk to us, we can. And somebody asked a question, is this being recorded? And will they have access to it? We did record it. We don't know how to send it out, but we will find out how to get it to you. So if you email us and we figure it out, we will be able to send it to you guys. Okay. Does anybody else have any questions? Nurse Russell, you have a question.
It was more of a comment. So when I applied to nursing school a long time ago, my friends and people that I did my prereqs with, they were getting letters that they were accepted or denied, and I did not receive anything. So I called the school and said I wasn't available for an RN. Someone had tried to get into RN, wasn't accepted, so they were able to get into the LVN program. And she did that in the same amount of time, and I had still heard nothing. On Thursday, I decided to check my junk mail, and not only was it there, but I had gotten into the RN program in the first attempt. So check your junk mail and check alternate emails or anything like that, because I was nervous for 4 days when the people I had did my prereqs with were all getting in or denied, and I had heard nothing and just had gone to my email.
That's
That
a good
is
point.
a very good point that you just made, because a lot of times they will send out emails, because they usually do it by email for students, but sometimes, you know, people make mistakes. The department may accidentally put a wrong letter in the email and you guys didn't get it. So refer back to your advisor, because usually the advisors will get a list of who's accepted into the program. And while we cannot tell you whether or not you got in or not, we can look it up and say, okay, these are the people you need to contact as to why you have not gotten a response from anybody. Because that has happened where I've seen students were admitted, they didn't know they were admitted. They got a hold of me. I looked and I saw it and I was like, okay, you need to contact them right away to figure out why you have not gotten a response. And then the student did find out. So thank you for bringing that up, Nurse Russell.
Yes.
That is a very good point.
Yes, definitely. Also, when you do receive that notice, you need to reply. You need to let them know, yes, although you did, it's obvious you want to, because you applied. However, you need to let them know whether you accept their offer of starting the program. There are some students who didn't respond, and guess what? You know what? They moved on to the next student. If you don't reply within the time frame that they tell you, then you may lose your spot. So make sure that you tell them, yes, I am going to start the program. And also make sure that you definitely read the website. Sonography received over 200 applications this year, and I forgot how many. She did mention there was a great amount of students who didn't include their student email. Something small like that, something just that alone can hurt your chances of even being considered.
Yes,
So
that's another really good point, because like radiology, it says everything must be included in a single envelope. If your T scores, if you paid additional money to have them sent to the college, that means they're not in your application. That means you're going to get disqualified. So make sure that you're reading things carefully, that you're going over it, that you're asking the advisor if you don't understand something. But if something is not included, I had a student that did include everything, but she, for whatever reason, when she downloaded her T scores, she forgot to include the page that had her score in it. So that disqualified her. So that was a real tragedy, because she probably would have gotten in that year. But make sure that you're going over things as often as you need to, and reach out to your advisor as often as you need to make sure that you understand everything.
Keep a folder. I would tell students, keep a folder, start getting so for instance, you go to the information session, you haven't taken the T's, but you went to the information session, you got your certificate of attendance, then put in your folder, you got your T scores, put it in your folder, you got your official transcripts, put it in your folder. So that way, when it comes down to it, you have everything together, right? You're missing one item and they won't even look at your application. They're going to put it to the side. So make sure that you're following instructions. And we forgot to mention that about the T's. Do not pay extra to send your T scores to the college, because I'm going to tell you, they're not going to know which program you're applying to, nor do they have the time to do that research. So don't pay that extra money. Save your money. Make sure you just print out your score, which you can access your ATI account once you've taken it, and print it out and put it in your packet.
And make sure you're writing down your username and password for when you create your T's account. So that way, when it's time to retrieve your scores, you're not looking for, oh my gosh, what did I do with this paper? And now I've got to request a new password and those kinds of things, because it can get confusing. Make sure you write it in a folder on a piece of paper that you have in a folder so that you're able to access them right away. Any other questions, guys? No? We're wonderful. You guys were awesome too. All right, guys. Well, thank you so much for attending. We really
Yes,
appreciate
thank
this.
you.
This is an annual thing. We do it every year. This year, last year was a lunch and learn. This year, it's the haunting truth of allied health. So thank you all for showing up, for asking questions, and for being great. And again, you guys have our information that we put on our evil slides, that you guys can reach out to us if you have anything else. But we will do this again next year, same time, same place. It'll probably be called something different. But again, thank you. And we are recording this session, so hopefully if anybody needs it, we will be able to send it out to whoever needs it. All right, or we'll post it somewhere, hopefully.
Yeah,
if we
send
can
us an
figure out.
email.
Shoot us an email. I am Sanchez17@alamo.edu. Francis?
F Calderon 4, which actually I'm going to put it in the
chat.
In the chat.
I know we have taken up a good almost 2 hours of your time. Hopefully all of you got some really great information out of this. And I know we got some really good information from Eduardo. So thank you, Eduardo, for being here today and for helping our students. And Nurse Russell, you were wonderful. Thank you.
Thank you, everyone. Thank you, Eduardo. Thank you, Nurse Russell. Also, registration's coming up November 8th. We sent out an email yesterday. So make sure that you register early so that you can get the best schedule possible. Alrighty. Thank you for joining us.